Well, firstly, a big thank you to everybody in this room. I've gotten to know you all in the last 6 months and happy to be back here again. I've learned a tremendous amount. I got this consulting business of mine going about coming up on the 6th month. So, a mixed feeling of excitement, a little scariness at times, and so on, but I've heard that's the way it is. So, I'll get going about my business a little bit, but just a quick blurb about myself. So, I'm a mechanical engineer. I've been in product development for about 30 some years of my life, and 20 of those 30 have been in medical devices right here in Kalamazoo with Stryker. And so I took the plunge Q4 of last year to kind of go on my own. And my biggest inspiration and motivation is what is it that I can continue to do for a long, long time? And this is something I feel I can carry on and pace it the way I want to do it. So that's the clicker, right? So what? Oh, it didn't click. Okay. So I think this is a little bit wordy here, but I wanted to get the point across on what is so critical about medical devices. And so I grabbed a $4 set of 3 syringes last night. It looks simple, it's plastic, it's got a needle on the front, and it's in a package. And at the end of the day, this thing, we all use it, or people use it on us, and it's got to be safe and it's got to be effective. And those are the two things that the FDA really cares about. And anything, a syringe like this, or a robot, or whatever we find in the medical community, that must get an FDA approval of some sort. So that's the linchpin here, the FDA approval. And what does an FDA approval mean? FDA requires you to follow a certain process, follow certain regulations, follow certain standards. They have a well-defined journey. It's got enough flexibility in it, but one needs to know what that journey is. And why would you want to know that journey? Firstly, if you don't do it right, you won't get the clearance. And you go on and on, it can take forever. So if you have not gone through the journey, you're going to take a lot of risks also, which you may not realize up front. And those can come and bite you, not only for a commercial success to launch something in the marketplace, but post the launch, you can get in trouble to the point of your business, and I've seen this happen, can shut down. So the key is like develop your product with that whole FDA in your mind. It's not just whip out a prototype and let's do it sort of thing. So that frankly is the leverage I want to provide to folks such as physician innovators, emerging companies, and even I put like as an advisory role to venture capital firms, med tech startups, etc. Frankly, I was looking at all the folks who have not gone through this journey, maybe barely done a little bit of a step, and they really don't know what they don't know. And so for them, and I've seen this happen where you're in your 8th year, in your 9th year, and you've got a brilliant idea. The thing I don't have is I'm not in the hospital to conceive those ideas. But they've got brilliant ideas, but they don't know how to get it to the finish line, and halfway through they're burnt out. There's no more cash left. Oops, I didn't realize this risk. So I think I'm trying to position myself to help these people get to a successful endpoint, conserve your cash, don't go through 100 different iterations. You'll go through like a few of those, and hopefully your success could be, after 2 tries, not after 10 tries. Now, can they go with anyone? Yeah, they can go with anyone. And one of the things is like, how do I position myself as, I'm not trying to be better than anyone else. There are all kinds of people. But this is where a lot of personal relationships and trust starts getting into picture. My service offerings, there are 4 key things. I'll get into strategy. So upfront, if you are a surgeon XYZ, we can talk simple things like intellectual property strategy. How do you get into the competitive marketplace analysis sort of thing? The core of it is product development. So how do you get from a back of a napkin sketch to a commercial launch? to a prototype stage. And then the other two on the far right, the talent part of it and the operations, is for a little bit more matured organization where you'll get into some of those things. So the biggest challenge is this is not like a one and done. I do need to have a recurring pipeline of clients. There'll be variety of clients. Some will be like, hey, once or twice, when some will be like repeat, hey, I've got a long pipeline of products that I want you to look at. Tried a number of things, attending all kinds, and this is frankly where I spend a lot of my time: networking, innovation hubs, showcases, and there's more to do. Personal contacts, trying to even connect with contract manufacturers locally. This is a pure referral based. It takes a lot of time. The third part is where I'm learning very quickly. People think you can whip this out in like 2 months, and come on, I've got $200 in my pocket, and come on, I've got to, and you can't preach and teach. So I guess the question now I guess I'm looking for ideas and tap into your brain. What other channels and what other ideas can I be looking at to grow this thing or to continue to build this? That's all.